Somewhere in a cave in northern Iraq, roughly 45,000 years ago, an adult Neanderthal man was living with an almost incomprehensible list of injuries: a withered, partially amputated arm, a crushed eye socket, likely leaving him blind on one side, signs of a serious leg injury that would have affected his ability to walk normally, and among all of it, a healed fracture, bone that had broken, and then unmistakably mended back together. Here's the detail that should stop you. This man, known to researchers as Shanadar I, lived for years, possibly decades, after these injuries occurred. In a world with no hospitals, no antibiotics, no surgery in any modern sense. Someone, or more likely, an entire group of someones, kept this man alive long enough for his bones to heal, which means the real story of ancient bone healing was never really about high-tech intervention at all. It was about understanding, sometimes with startling sophistication, exactly how to support a process the human body was already fully capable of doing on its own. Before looking at what ancient humans actually did, it helps to understand the process they were actually working with, because bone healing isn't something doctors invented. It's something the human body does automatically, given the right conditions. When a bone breaks, the body immediately begins forming a blood clot at the fracture site, called a hematoma, which acts as an initial scaffold for the repair process to begin. Within days, the body starts producing a soft initial repair tissue called a callus, essentially a temporary bridge of cells spanning the gap in the broken bone. Over subsequent weeks, that soft callus is gradually replaced by genuine new bone tissue, which the body then continues to reshape and strengthen over months, sometimes gradually restoring an injured bone to nearly its original strength and shape. This process happens whether or not any human intervenes at all. What ancient healers actually needed to figure out wasn't how to make bone heal. It was how to keep a broken limb properly aligned and immobilized long enough for that automatic biological process to finish its work correctly, rather than healing crooked, misaligned, or not at all. That single insight, immobilization supporting a process the body already knows how to do, turns out to be the exact same core principle modern orthopedic medicine still relies on today. Some of the clearest, most direct physical evidence for ancient bone setting comes from ancient Egypt, where dry desert conditions preserved not just skeletal remains, but the actual splinting materials used to treat them. Archaeologists have discovered ancient Egyptian mummies and skeletal remains, some dating back roughly 5,000 years, with splints still in place, constructed from materials like bamboo, reed, or bark, padded with linen, and bound firmly around a fractured limb. These weren't crude, improvised restraints. The splints show clear evidence of deliberate craftsmanship, shaped and padded specifically to immobilize the injured limb while distributing pressure in a way that wouldn't cut off circulation or cause additional damage to the surrounding tissue. Egyptian medical practice also developed something functionally similar to a modern hard cast. Linen bandages stiffened using natural resin or similar hardening substances, creating a rigid, supportive shell around the injured limb once it dried. An early precursor to the plaster casts modern medicine wouldn't formally develop until many centuries later. This level of sophistication didn't emerge in isolation. It appears alongside one of the most remarkable surviving documents in the entire history of medicine, the Edwin Smith Papyrus, an ancient Egyptian medical text dating to roughly 1600 BCE. Though widely believed by scholars to be a copy of a considerably older original document, represents one of the oldest known surgical and trauma treatment texts in human history. What makes this document genuinely extraordinary isn't just its age. It's the strikingly rational, methodical, almost clinical approach it takes toward describing traumatic injuries, a sharp departure from the heavily magical and religious framing found in many other ancient Egyptian medical texts of the same general era. The papyrus documents 48 individual case studies, each following a consistent, structured format: a description of the specific injury, an examination the physician should perform, a diagnosis and a recommended treatment, or, in a detail modern historians find genuinely striking, in several cases an honest acknowledgement that a particular injury was untreatable, with no attempt made to fabricate false hope or invent an ineffective remedy. Among these cases, the papyrus includes descriptions of fracture treatment, recommending techniques for reducing, meaning realigning, a displaced bone, and then immobilizing it using splints, guidance consistent with the archaeological splint evidence discovered separately in Egyptian mummies. This combination, physical splints preserved directly on ancient bodies, alongside a written medical text describing the exact reasoning and procedure behind that same treatment, gives researchers a rare, unusually complete picture of ancient orthopedic practice, both the theory and the physical result, from the same broad civilization and era. Ancient Greek medicine, particularly the body of work traditionally attributed to Hippocrates, developed bone-setting technique further, with a level of descriptive precision that genuinely surprised later historians of medicine studying the original texts. The Hippocratic Corpus, a large collection of ancient Greek medical writings, includes remarkably detailed descriptions of fracture reduction, dislocations, and the specific mechanical techniques needed to properly realign broken and dislocated bones before immobilizing them. One particularly well-documented device, sometimes called the Hippocratic bench, used a system of ropes, winches, and leverage to apply controlled, steady traction to an injured limb, allowing a physician to gradually pull a displaced fracture back into correct alignment before splinting it in place, a mechanically sophisticated solution to a problem that still requires careful, controlled force in modern orthopedic practice today. Hippocratic texts also describe the importance of checking limb length and alignment after treatment, comparing an injured limb directly against the healthy opposite limb to verify proper healing position, a basic but genuinely important clinical practice that remains directly relevant in modern fracture assessment. Perhaps most notably, Hippocratic writers explicitly documented observations about which types of fractures tended to heal well under this treatment approach and which tended to heal poorly or with lasting complications, an early empirical form of clinical outcome tracking built entirely from accumulated direct observation across many patients. Centuries before anything resembling formal medical research existed, beyond splinting and mechanical reduction, ancient healers across numerous separate cultures independently turned to specific plants believed to aid bone healing, and at least one of these traditional remedies turns out to have genuine, scientifically identifiable pharmacological grounding. Comfrey, a plant historically nicknamed knitbone across multiple European folk medicine traditions, was traditionally applied as a poultice directly over fractures and other injuries, based on a long-standing belief that it genuinely helped bones heal faster and more effectively. Modern chemical analysis has identified allantoin, a compound naturally present in comfrey, which has been shown in laboratory research to promote cell proliferation, potentially supporting and accelerating the natural tissue repair process already underway at an injury site. This doesn't mean comfrey was some kind of miracle ancient cure, and modern medical guidance around comfrey is notably cautious, since the same plant also contains compounds linked to liver toxicity with heavy internal use, meaning traditional external topical application specifically, rather than internal consumption, was very likely the safer, more medically sound instinct, whether or not the people using it fully understood why. What matters here isn't that ancient herbalists had modern pharmacological knowledge. It's that centuries of direct, repeated trial and observation across an enormous number of individual treated patients appear to have converged on a specific plant that turns out to contain a genuinely bioactive healing compound entirely without any understanding of cellular biology to explain why it seemed to help. Perhaps the most dramatic evidence of ancient bone and skull treatment comes from trepanation, the deliberate practice of cutting or drilling a hole into the skull, performed by numerous ancient cultures across the world independently for reasons researchers still don't fully understand in every individual case. While trepanation is often popularly associated with mystical or ritual purposes, and in some documented cases likely was performed for exactly that reason, a substantial number of examined trepanned skulls, found across ancient Peru in particularly large numbers, show something medically remarkable: clear evidence of new bone growth around the edges of the trepanation hole. Bone doesn't regrow around damaged tissue unless the patient survived the procedure for a meaningful length of time afterward, which means these specific skulls provide direct, physical proof that a significant number of ancient patients survived what was, by any definition, actual invasive cranial surgery performed with nothing resembling modern anesthesia, sterilization, or surgical tools. Research examining large samples of ancient Peruvian trepanned skulls across different time periods has documented survival rates that appear to improve over centuries, suggesting genuine accumulated surgical skill and technique refinement passed down through successive generations of practitioners rather than a single static, unchanging method applied blindly and without any real feedback or improvement over time. Whatever combination of practical medical necessity, likely including treatment for genuine skull fractures and swelling following head trauma, and ritual or spiritual belief motivated this practice, the surviving physical evidence makes one thing unambiguous. Ancient practitioners in multiple, entirely separate parts of the world were performing genuine invasive skull surgery, and a meaningful percentage of the time, their patients were actually surviving it. So how did ancient humans heal broken bones without modern surgery? They didn't need to surgically fix a fracture in the way modern medicine sometimes still does today, because the human body was already fully capable of healing a broken bone entirely on its own, given the right supporting conditions. What ancient healers actually needed to master was supporting that existing biological process correctly, realigning a displaced bone through careful mechanical traction, immobilizing it firmly enough using splints, resin-stiffened linen, or other locally available materials to let the body's own natural repair process finish its work undisturbed. Egyptian physicians left behind both the physical splints and a written medical text describing the exact reasoning behind their use. Greek physicians developed increasingly refined mechanical devices and documented systematic observation of treatment outcomes across many patients. Traditional herbalists, working through pure trial and accumulated observation, converged on at least one plant remedy that modern chemistry has since confirmed contains a genuinely active healing compound. And in Peru, ancient surgeons performed and gradually refined genuine invasive cranial surgery, leaving behind, embedded directly in regrown bone, unmistakable physical proof that their patients often survived, and somewhere in a cave in Iraq, tens of thousands of years before any of these more sophisticated systems existed, a badly injured Neanderthal man lived on for years, his fractured bone healed and solid, kept alive not by any specific medical technique at all, but by the far older, far simpler technology this entire story ultimately rests on. Other people, willing to keep him fed, warm, and protected for exactly as long as his own body needed to do the rest of the work itself.